when a patient is diagnosed with a breast cancer, what do we do next? So sometimes the dilemmas start even from there. Should we remove it to see, or should we go ahead with surgery, what they're saying? So most of the places, they will first do what we call as a true cut biopsy. So even there, another opinion, suppose one person is telling you that we have to take out the complete lump to see, that's not a necessity now. Another opinion is going to help you to decide whether, which type of surgery, even a needle biopsy is enough. Similarly, when we go for surgery, okay, there are many types of surgery available, and not everywhere that we have to take out the complete breast. We can preserve the breast. So what type of surgery? And again, even when you're preserving the breast, sometimes what we do is that we have to take out the axillary nodes, the nodes which are present near the breast. So again, not always do we need to do a complete nodal dissection, complete nodal surgery. There can be something called a sentinel node biopsy, which is now available with most of the centers. And from there, suppose the sentinel node biopsy comes out as positive, only then an axillary nodal surgery is necessary. So many a time, another opinion will throw this out to you. Okay, fine, we can go ahead with a sentinel node biopsy. Why not we do that instead of going ahead with two surgeries at the same time? Now, another thing, once you finish the surgery and all, a biopsy report has to be very comprehensive about what are the margins, where is small details in the biopsy report, and then the ER, PR, that is the estrogen receptors, PR, progesterone receptors. There has to be a comprehensive biopsy report. So if something has been left out, a second opinion can help you. Please go for this. Do the IHC markers, which is ER, PR, HER2/neu. Once we finish the surgery, next is we have to look at, what is the next treatment. Even here, there are many areas where decisions are made. Sometimes patients require chemotherapy. Sometimes patients do not require chemotherapy. If it is a very small tumor, there is no nodal involvement, and a good surgery has been done, there are many patients where they do not require chemotherapy. So here, an opinion can throw this, that you can go and do other tests which will take about 1 month's time to come, the results to come. And then we can proceed to say, okay, there is no need for a chemotherapy. You can only go for a hormonal therapy. So these things, even a normal medical oncologist or your treating oncologist can tell you. However, these things can also be thrown up in a second opinion. Coming to radiation. In radiation, there are different types of radiation which can be offered depending on which side is the disease and what do we want. Sometimes we want to save, every time we want to save the normal structures, but there are different techniques which are available which can really bring down the dose to the structures like heart, like what we call as deep inspiratory breath hold, DIBH. These sort of techniques are available, and such information which is available actually empowers the patient. Nowadays, you have techniques where the number of treatments in radiation can come down, what we call as hypofractionated radiotherapy. Now, is it possible for my patient? These informations, it is the information that you get which empowers you, and a second opinion is actually going to give you much more of information. And lastly, once you've completed treatment, many patients come back to us asking, what happens? Is my daughter more at risk? What happens to, some have come back and told us that, there has been breast cancer in the family. My mother had it, my Mausi had it. What is the risk for my daughter? Or is there a risk for my sister's daughter? Now, there are genetic counseling available and gene testing available, which can throw up what is your risk or the risk in the subsequent generation, so that they can start any, screening procedures much earlier in life. Now, these are the areas where second opinions are going to help you.